Good afternoon, this is Media Center, Ukraine, Odesa. We are starting for today, and our first briefing is dedicated to legalization of medical cannabis. This is a wide discussion in Ukraine for the last several years, and we will try to discuss this topic with Kostiantyn Shevchenko-Bitenskyi, psychiatrist, and Liudmyla Sakali, oncologist. Kostiantyn, the floor is yours. Legalization of medical cannabis. What can it change in your practice, and is it really needed? In my practice and in practice of psychiatrists, it will widen our activities when it comes to PTSD and acute response to stress, depression, panic attacks, and severe neurosis that we all can already face now, and we expect increased number of such cases after our servicemen return from the front line after our victory. Such cannabis-based medicines will have less adverse effects. We will be able to influence the organism, and we can expect some good results. This is needed because if we can prepare now all necessary documentation, of course, we can say that maybe this is not the most urgent issue now, but we should face the truth because bureaucracy can take a long time, and thanks to expediting the process now, by the end of the war, and we hope that it will be as soon as possible, we will have some new ways of treatment. Thank you. And now I would like to give floor to Liudmyla Sakali, an oncologist. What can you say from the perspective of your practice? How can you decrease suffering of your patients? Patients with oncology, especially at terminal stages, have a severe pain syndrome related to their disease. Of course, we need to try to cope with it with medication, and the vegetable origin of cannabis allows to fight with adverse effects, and which decrease the quality of life of people. That's why medical cannabis can not only help to cope with pain, but can also kind of prolong life of such patients, because they will not be so many adverse effects. And of course, there is the topic of turnover of such medication. As far as I know, and I've started the draft law submitted by the MPs representing the Committee of National Health. And it is very important for me personally because national health cannot cover some separate areas like patients with PTSD or with oncology or with some other diseases where medical cannabis can be used. But we should also speak about the importance of abuses of use of such medication. And it is very important to remember about the risk for teenagers whose nervous system can be affected the most. As an oncologist, I call for improving the quality of life of people and for reducing their pain. But we should focus on how such medications will be used. Will there be special form introduced? So will the process be properly regulated for selling and buying of such medicines? Kostiantyn, you've mentioned that medical cannabis can help a lot for people with PTSD, with anxiety. How can you actually explain this to non-professionals, non-medical professionals? Because as far as I understand, that we are not talking about treating such conditions. You just simplifies your practice. Can you share more details about this? Yes, sure. So we can see the impact of explosions, hostiles, and the neural system is now hyperactive, and any stress can cause turmoil. And perhaps in the past, people could even not notice this. And such cells, they need to spend more time, like more effects to support the homeostasis and for proper response. And when it comes to cannabis oil, we allow cells of the nervous system to have some rest. Of course, we need to accompany the administration of medical cannabis with, for example, other types of therapies. Therapy. Of course, cannabis cannot change anything in your mind. Only another person, only professional, can help you to work through the anxiety, the sadness that you have. This is when it comes to PTSD. When it comes to depressive states, when we can elevate this mental pain that a person suffers if the person has depression. And we know that antidepressants, they cannot treat depression. They help people to cope with depression, and after depression is over, the professional psychiatrist start to gradually remove antidepressants from the treatment. So this is a palliative care. The same as it was mentioned by my colleague, an oncologist. So this is kind of an umbrella that covers people and helps them to cope with acute states like depression or grief. Of course, we cannot use medical cannabis for treatment solely. I have a question from a journalist watching us online, and I have a question about antidepressants. Some of my friends who addressed a psychiatrist for help, they just were administered with such antidepressants for quite a long period of time, during 1 month, 2 months, then a break, then the process is repeated again. Can we expect more severe adverse effects when it comes to medical cannabis comparing to antidepressants? Yes, this is a very sensitive question. So there is no official research proving the effectiveness of antidepressants, so that it could be higher than placebo. So this is like a separate topic for discussion, which is not our focus of today. As for medical cannabis, if your question is about how cannabis can affect people in the future, and again, we don't have enough research in this area that could provide information about the potential all negative adverse effects after long-term administration of medical cannabis, and like millions of people will need such medication after the war is over. So you can just imagine the scale. But if we do not allow our patients to intake this, is we do not allow the research institutions to study these medication, we will never know the result. And when it comes to our colleagues from Europe, from the United States, they have already got the first positive results after research of this medical cannabis. We at least should have the possibility to study the question. So I have a question from the journalist watching online. What is the difference between medical marijuana and non-medical marijuana, or medical, non-medical cannabis? Liudmyla, can you answer the question? And the so-called like on this industrial cannabis has less percentage of THC and its concentration, and this concentration is higher in medical cannabis. It is higher than 0.3%. So this is the only difference. And of course, the procedure for fighting this raising the active component, it is different. So medical is more in medical cannabis. THC is more concentrated. So yes, this is the active part of cannabis. The concentration is higher comparing to like common cannabis. And we have the THC, which is the medical part, and some other elements, which is responsible for the high. When it comes to THC, it helps to cope with nausea. It helps help relieve pain, and so you need just to intake really a huge amount of medical cannabis to feel high. There is a question, if I understand you right. Just don't forget to use the mic. Turn it on and use the mic just for the question to be heard by the audience.
Do you understand me in English too?
Yes.
Perfect. I got a question. So I'm from Germany, and we actually right now are working on a complete legalization of cannabis. Is this common here? Is this also like a role model? Second question would be that you said that cannabis could be used to cure depressants or also like other issues. Also, there are studies shown that there's also could be a link of the misuse of cannabis, which is increasing, which is increasing depressions or other symptoms. What do you think about that? Could this also like be a turnaround?
Thank you very much for your question. This is a great question, emphasizing what I have mentioned before. So we need to have as many research as possible with regard to using medical cannabis for treating mental states. Of course, there are negative examples when administration of medical cannabis for schizophrenia or some other states that can just aggravate the state. But we don't have now enough information just to tell that there is kind of a pattern when it comes to neuroses and depressions. Thank you. I have a question. And perhaps this is the question to Liudmyla, or perhaps to Kostiantyn as well. When we were preparing to this press conference, I discussed the topic with some people who are against legalization of medical cannabis. And they tell that some of the doctors do not use the full capacity of medication that can substitute cannabis like painkillers, but they don't use the full capacity because they are bad doctors, but because they are afraid to prescribe medication from the list of limited use because they are afraid of law enforcement bodies who can blame them for drug trafficking. Do you know anything about such threats? And can the same be told about medical cannabis? That's why I actually emphasize the importance of regulating the use of medical cannabis. So there are special law enforcement bodies that regulate such issues at the national and regional state. And it is very important to include medical cannabis to the list of such medications, and the prescribing procedure should be well developed for such drugs that are included in the so-called List A. And I believe that this is very important, and this will allow the legal circulation as for other drugs that are used now for treatment, for pain killing when it comes to patients with oncology and mental disorders. That's why it is very important to ensure proper circulation of medical cannabis. As for your question about using full capacity of different medication, and if it will be properly explained to professionals the importance of using medical cannabis when it comes to reducing adverse effects, and also this can like simplify the life not only of patients but of doctors, because when we have patients with severe conditions complaining about pain, we become psychiatrists for such patients. And of course, if we remove the pain element, this will improve the life of patients. And I'm not sure that that was Hippocrates who says that, but someone told once that I don't want to live in life without heroin. And actually, I can say that I will be afraid of prescribing medical cannabis at first if we don't have proper legislative framework. We need to have a roadmap, a legal framework for us not to be afraid to prescribe such medication. And I can fully understand my colleagues who are afraid to do this. And we can use like different types of drug-based medication like MDA, which is used for treating PTSD in Australia, and it is ketamine, for example. We have a clinic helping to treat the states of alcoholics with it, but everyone is afraid now because it is unclear how the roadmap will be developed. But I think that there will be special forms that will be used by healthcare institutions after proper certification, after getting all permissions. And of course, this will make my colleagues more sure in prescribing such medication. But at first, all of us will be afraid. Thank you. If there are no other questions from the floor, then we can stop here. I would like to thank you very much for your time, and thank you for explaining the situation. And we hope, let's hope for a transparent roadmap and for successful implementation. Thank you. Unfortunately, we were not able to invite opponents of the idea of legalizing medical cannabis because they're still there. And if they have a constructive position, we will be gladly provide this platform for them sharing their concerns. Thank you. Our next briefing will be in 40 minutes at noon, and it will be dedicated to the situation connected with Olga Harlan at the World Fencing Championships, and we will have representative of federation and the sports experts. Stay tuned.